So, just as a brief introduction, can you talk to us a little bit more about the whole Christian Vaccine Access Coalition and your inspiration when founding the Christian Vaccine Access Coalition?
Well, so it was my father-in-law, and he, on dialysis, we were thinking he should be first in line because he was an early one in his 80s. And they weren't able to set him up for a vaccine. They told him to go to Ochsner or Turo, and then Turo didn't have anything. Well, so that was a problem. He had already lost his wife. We had already lost my mother-in-law. And so the challenge of trying to find out who had vaccines was insurmountable. And we're thinking, my wife's a social worker. I'm a pharmacist. If we're having trouble, imagine what everybody else is going through. And they need this vaccine to live. So what we decided was sent out an email, and Tanisha was on the email. I included her because I know she's always interested in helping out. And to see who would be interested in helping to make calls to find out who has vaccines, because that's what we had to do, find out who has vaccines. So we got a great response. It started out with the church, and where people really wanted to help out. So set up a website. So people have been able to call and find out, or just check the website to see who has vaccines, and it's made a difference. So that's the Christian Vaccine Access Coalition, and I think they call it CVAC or something like
that. Thank you so much for that. So what are some suggestions you have going forward from the pandemic, as a community pharmacist, for someone who's interested in future healthcare?
Disparities have been in place way before COVID, but it highlighted it in a way that I don't think maybe many other things would be able to do. Because even for vaccine access, those that had power and access were able to get to the vaccines. Those without power and access haven't been able to, as much. So we see some big disparities there. And so pharmacists, right in the community must realize that we have to do more than dispense drugs, but have relationships with people where we can create systems, where we can create mechanisms, where people can be helped. And I don't think pharmacy has looked at it that way. I don't think medicine has looked at it that way.
In the future, do you believe that this is a problem that can be resolved, or do you believe that the issue of, vaccine nationalism or medicine becoming more of like, a competition, a nationalist sense of pride rather than, a science that is distributed for the benefit of the people? Do you think that will be an issue in future decades, or do you think that maybe future generations do have the power to resolve this, and how?
Oh, yeah, I'm very, very hopeful. Well, one, if we look at things historically, a bad thing is things are bad, but a good thing is that we're at a point where it becomes intolerable, the systems that we have right now. And so by the change is coming. We're in the middle of change. And I think that people who care about people, again, we don't all have to believe the same thing. We don't all have to, we can be individuals come from different walks of life, all right, and still care. We can join together in unity and say that we care. And we're not going to block ourselves off. We just want to help people. And so I believe that that is coming. I see so much hope because people are tired of, those who are attempting to only take care of their own and not take care of humanity. It's over and over again that people are about sick and tired of it. And I see a movement where people are saying, no, we're not going to take it anymore.
One last question to wrap up, because I do understand that you're busy. You're very much, Dr. Sylvain, a leader in not only your personal community, but in the New Orleans community as well. And I was wondering what advice you would give to people who are inspired by the work that you do in the leadership initiative that you have again.
The advice I would give would be to care. I think caring drives everything. Selfishness is a disease. You know, it really, really is. Selfishness is a horrible disease that hurts people. It locks people in. But if we can be content, recognize that we can't hog everything, and care about others. Caring creates leadership. That's all leaders do. Leaders are the ones who care. They're caring and then being able to communicate. You know, that's critical, to care and communicate. And so I think the inspiration has to be to care and communicate and multiply that, where we reach others to help them learn how to care and communicate. You know, and each one teach one.
Thank you so much for your time, Dr. Sylvain. This has truly been an honor.